inspected about 50% of hospitals in England, and it started with those about which it had the greatest concern. So there's a caveat. Given all of that, are these, though, the sort of findings that you would want and you would expect?
So the great thing about this report, I think, is it's a serious report that we have to take very seriously. And we've been saying for some time that the Care Quality Commission needs to make sure that it's painting a balanced view of what's going on in the service. Now, if you read the full report, what it says is that the vast majority of care is good and that some of it's outstanding. Now, I think that we've got to take that first. What we then need to do is take incredibly seriously the fact that it says that there's significant variation and concern.
I mean, that comes up a lot,
yes,
doesn't it? Huge variation. So there's a lot of luck of the draw as far as the patient is concerned.
So I think luck of the draw is a bit harsh. I think what we're seeing is that we've got a new inspection regime which looks in the round at care. And what the findings don't say, which is widely reported, is that 3/4 of hospitals are unsafe. That's just not what it says. And the Care Quality Commission have been very clear to point that out. Alongside the fact that they're saying most care is good and some of it's outstanding, what we're seeing is that there are some places where when the inspections happened, some services have required some immediate action because the inspectors have found things that aren't right. And having that lens and that mirror held up to the service is a good thing, we would say. What they also say is that there are other hospitals who need to look at safety in a different way so that they prevent more harm rather than harm is happening to people. Now, these nuances are quite important to understand. The really, really powerful things in this report, though, I think are about how the people that we represent, the leaders in the system, need to be much more supported in the way that they deliver safe care in the future, in the context we're in. That means they have to work together and be supported to work together, and that things like staffing numbers need to be taken into consideration and the availability of staff.
Yeah, I mean, perhaps we'll talk more about that in a moment because, of course, there's the announcement about nurses today as well. But you talk about leaders. Isn't it fair to say that those hospitals which have excellent standards have very strong leadership? I mean, it's got to come from the top, hasn't it?
It does, and what I'm really delighted that what we're seeing is a recognition that value-based leadership that engages staff in understanding the organisation and how we all should share a view on the way that services should change and improve is the way forward. And over the last few years, there's been a move towards this and a much greater understanding that that's what we should be fostering. This comes on the back of earlier research by people like the Leadership Academy that said that, 5 years or so ago, the prevailing leadership was more about pace setting and direction and telling people what to do. Now, in healthcare, that's not the right answer. We've got to work with the frontline staff that we have, 91% of whom are caring individuals delivering great care according to this report, if we're going to have a successful NHS in the future.
I mean, are those leaders prepared to look at best practice, though? Because you make the point we've got variations, therefore some clearly are doing it very well, some are not. Shouldn't it just be a given that those that are doing well should be examined all the time, and those that are not doing so well should be saying, why and how are they getting it right, and how can we learn from that?
And that's a great question, because the infrastructure at the moment that we have is one where, and to the committee looking at this alongside NHS employers and most of the national bodies saying you've got to do this. There are people we've employed who are waiting for a licence who could start